1. Nurse may tries to design an organizational structure that allows communication to flow in all directions and involve workers in decision making. Which form of organizational structure is this? A. Centralized. B. Decentralized. C. Matrix. D. Informal. Correct answer. B. Decentralized structures allow the staff to make decisions on matters pertaining to their practice and communicate in downward, upward, lateral and diagonal flow. 2. When documenting information in a client's medical record, the nurse should A. Erase any errors. B. Use a number 2 pencil. C. Leave one line blank before each new entry. D. End each entry with the nurse's signature and title. Correct answer. D. The end of each entry should include the nurse's signature and title. The signature holds the nurse accountable for the recorded information. Erasing errors in documentation on a legal document such as a client's chart isn't permitted by law. Because a client's medical record is considered a legal document, the nurse should make all entries in ink. The nurse is accountable for the information recorded and therefore shouldn't leave any blank lines in which another healthcare worker could make additions. 3. Functional nursing has some advantages. Which one is an exception? A. Psychological and sociological needs are emphasized. B. Great control of work activities. C. Most economical way of delivering nursing services. D. Workers feel secure and dependent role. Correct answer. A. When the functional method is used, the psychological and sociological needs of the patients are neglected. The patients are regarded as tasks to be done. 4. When planning care with a client during the postoperative recovery period following an abdominal hysterectomy and bilateral salpingo-oophorectomy, Nurse Frida should include the explanation that A. Surgical menopause will occur. B. Urinary retention is a common problem. C. Weight gain is expected, and dietary plan are needed. D. Depression is normal and should be expected. Correct answer. A. When a bilateral oophorectomy is performed, both ovaries are excised, eliminating ovarian hormones and initiating response. 5. Before a client whose left hand has been amputated can be fitted for a prosthesis, Nurse Joy is aware that A. Arm and shoulder muscles must be developed. B. Shrinkage of the residual limb must be completed. C. Dexterity in the other extremity must be achieved. D. Full adjustment to the altered body image must have occurred. Correct answer. B. Shrinkage of the residual limb, resulting from reduction of subcutaneous fat and interstitial fluid, must occur for an adequate fit between the limb and the prosthesis. 6. The PHN bag is an important tool in providing nursing care during a home visit. The most important principle of bag technique states that it A. Should save time and effort. B. Should minimize if not totally prevent the spread of infection. C. Should not overshadow concern for the patient and his family. D. May be done in a variety of ways depending on the home situation, etc. Correct answer. B. Bag technique is performed before and after handling a client in the home to prevent transmission of infection to and from the client. 7. When administering pancrelipase pancreases capsules to child with cystic fibrosis, Nurse Faith knows they should be given A. With meals and snacks. B. Every 3 hours while awake. C. On awakening, following meals, and at bedtime. D. After each bowel movement and after postural drainage. Correct answer. A. Pancreas's capsules must be taken with food and snacks because it acts on the nutrients and readies them for absorption. 8. Nurse Jen is aware that isolation of a child with measles belongs to what level of prevention? A. Primary. B. Secondary. C. Intermediate. D. Tertiary. Correct answer. A. The purpose of isolating a client with a communicable disease is to protect those who are not sick. Specific disease prevention. 9. A preterm neonate is receiving oxygen by an overhead hood. During the time the infant is under the hood, it would be appropriate for Nurse Gian to A. Hydrate the infant Q15 minute. B. Put a hat on the infant's head. C. Keep the oxygen concentration consistent. D. Remove the infant Q15 minute for stimulation. Correct answer. B. Oxygen has cooling effect, and the baby should be kept warm so that metabolic activity and oxygen demands are not increased. 10. Nurse Len knows that the most important aspect of the preoperative care for a child with Wilms tumor would be A. Checking the size of the child's liver. B. Monitoring the child's blood pressure. C. Maintaining the child in a prone position. D. Collecting the child's urine for culture and sensitivity. Correct answer. B. Because the tumor is of renal origin, the renin-angiotensin mechanism can be involved, and blood pressure monitoring is important. 11. The central problem the nurse might face with a disturbed schizophrenic client is the client's A. Suspicious feelings. B. Continuous pacing. C. Relationship with the family. D. Concern about working with others. Correct answer. A. The nurse must deal with these feelings and establish basic trust to promote a therapeutic milieu. 12. Realizing that the hypokalemia is a side effect of steroid therapy, Nurse Monette should monitor a client taking steroid medication for A. Hyperactive reflexes. B. An increased pulse rate. C. Nausea, vomiting, and diarrhea. D. Leg weakness with muscle cramps. Correct answer. D. Impulse conduction of skeletal muscle is impaired with decreased potassium levels. Muscular weakness and cramps may occur with hypokalemia. 13. An obese client asks Nurse Elmer how to lose weight. Before answering, the nurse should remember that long-term weight loss occurs best when A. Eating patterns are altered. B. Fats are limited in the diet. C. Carbohydrates are regulated. D. Exercise is a major component. Correct answer. A. A new dietary regimen, with a balance of foods from the food pyramid, must be established and continued for weight reduction to occur and be maintained. 14. As an epidemiologist, Nurse Celeste is responsible for reporting cases of notifiable diseases. What law mandates reporting of cases of notifiable diseases? A. Act 3573. B. RA 3753. C. RA 1054. D. RA 1082. Correct answer. A. Act 3573, the Law on Reporting of Communicable Diseases, enacted in 1929, mandated the reporting of diseases listed in the law to the nearest health station. 15. A child visits the clinic for a 6-week checkup after a tonsillectomy and adenoidectomy. In addition to assessing hearing, the nurse should include an assessment of the child's A. Taste and smell. B. Taste and speech. C. Swallowing and smell. D. Swallowing and speech. Correct answer. A. Swelling can obstruct nasal breathing, interfering with the senses of taste and smell. 16. Which of the following factors are major components of a client's general background drug history? A. Allergies and socioeconomic status. B. Urine output and allergies. C. Gastric reflex and age. D. Bowel habits and allergies. Correct answer. A. General background data consist of such components as allergies, medical history, habits, socioeconomic status, lifestyle, beliefs, and sensory deficits. Urine output, gastric reflex, and bowel habits are significant only if a disease affecting these functions is present. 17. According to C. E. Winslow, which of the following is the goal of public health? A. For people to attain their birthrights of health and longevity. B. For promotion of health and prevention of disease. C. For people to have access to basic health services. D. For people to be organized in their health efforts. Correct answer. A. According to Winslow, all public health efforts are for people to realize their birthrights of health and longevity. 18. Which of the following is the best guarantee that the patient's priority needs are met? A. Checking with the relative of the patient. B. Preparing a nursing care plan in collaboration with the patient. C. Consulting with the physician. D. Coordinating with other members of the team. Correct answer. B. The best source of information about the priority needs of the patient is the patient himself. Hence, using a nursing care plan based on his expressed priority needs would ensure meeting his needs effectively. 19. A 10-year-old girl is admitted to the pediatric unit for recurrent pain and swelling of her joints, particularly her knees and ankles. Her diagnosis is juvenile rheumatoid arthritis. Nurse Jana recognizes that besides joint inflammation, a unique manifestation of the rheumatoid process involves the A. Ears. B. Eyes. C. Liver. D. Brain. Correct answer. B. Rheumatoid arthritis can cause inflammation of the iris and ciliary body of the eyes, which may lead to blindness. 20. Food fortification is one of the strategies to prevent micronutrient deficiency conditions. RA 8976 mandates fortification of certain food items. Which of the following is among these food items? A. Sugar. B. Bread. C. Margarine. D. Filled milk. Correct answer. A. RA 8976 mandates fortification of rice, wheat flour, sugar and cooking oil with vitamin A, iron and/or iodine. 21. When a client on labor experiences the urge to push a 9 cm dilation, the breathing pattern that Nurse Rhea should instruct the client to use is the A. Expulsion pattern. B. Slow-paced pattern. C. Shallow chest pattern. D. Blowing pattern. Correct answer. D. Clients should use a blowing pattern to overcome the premature urge to push. 22. During the first 48 hours after a severe burn of 40% of the client's body surface, the nurse's assessment should include observations for water intoxication. Associated adaptations include A. Sooty-colored sputum, B. Frothy pink-tinged sputum, C. Twitching and disorientation, D. Urine output below 30 milliliters per hour. Correct answer. C. Excess extracellular fluid moves into cells. Water intoxication. Intracellular fluid excess in sensitive brain cells causes altered mental status. Other signs include anorexia nervosa, nausea, vomiting, twitching, sleepiness, and convulsions. 23. Rain is a BSN graduate. She wants to become a public health nurse. Where will she apply? A. Department of Health. B. Provincial Health Office. C. Regional Health Office. D. Rural Health Unit. Correct answer. D. RA 7160 devolved basic health services to local government units, LGUs. The public health nurse is an employee of the LGU. 24. To assess orientation to place in a client suspected of having dementia of the Alzheimer's type, Nurse Chris should ask: A. Where are you? B. Who brought you here? C. Do you know where you are? D. How long have you been there? Correct answer. A. Where are you? Is the best question to elicit information about the client's orientation to place because it encourages a response that can be assessed. 25. Nursemaid tells one of the staff, "I don't have time to discuss the matter with you now. See me in my office later," when the latter asks if they can talk about an issue. Which of the following conflict resolution strategies did she use? A. Smoothing. B. Compromise. C. Avoidance. D. Restriction. Correct answer. C. This strategy shuns discussing the issue head-on and prefers to postpone it to a later time. In effect, the problem remains unsolved and both parties are in a lose-lose situation.